Good evening, everyone. Thank you for making time to join us with our case acceptance series. This is part two. If you missed part one, I'm going to send an email out to everyone, and I'll give you some of the highlights of what we had in part one. We have part two tonight, so I love it that everybody's wanting to get better. That's what this is. Showing up on a Tuesday evening, you're wanting to improve, you're wanting to get better. We have some repeat attendees from the last webinar, and plenty of new people that are here with us. And we plan on continuing to do this. We have plans to bring your hygienist. We have plans to bring your treatment plan coordinator, and we have other plans with Dr. Hyman that we're going to do just to continue to get a little bit deeper. He plants the seeds and gives nuggets, but his knowledge is tough to consume all at one time. So we're going to continue to break this up. Be sure and stay to the very end. So we're going to be about 30 minutes with Dr. Hyman. We've got about 15 minutes of Q&A. And then we have Brian Sawoya. Brian Sawoya is one of the regional VPs with Digital Doc, and he has some information for you around the D code. It's D0350. All right, and how you can add annually about $25,000 or so to your practice. He's going to practically walk you through what that looks like. So he's got the last 15 minutes of this evening. So stay tuned for that, and we'll have Brian join us in a little bit. So returning guest this evening, Dr. Mark Hyman owned and operated on the top 1% dental practices in the nation out of Greensboro, North Carolina. You can tell he's a Tar Heels fan, die hard. He represents it proud. He's current faculty at the UNC Dental School. He sells out courses all over the nation. He's famous for taking pictures of all of his attendees, and they're all doing the wave in his courses. If you haven't seen him live, it's captivating. What I love about Dr. Hyman is he's lived this. He's lived every word that he's going to say tonight, and in his practice with his patients, he's super genuine. You're gonna be able to tell that. And the man's got amazing hair. He does. I mean, look at his hair. So I'm pleased to welcome my friend, Dr. Mark Hyman.
Brett, what a joy to see you again. Welcome, everybody. I'm really honored and touched. I've got several of my friends on tonight and some prospective pre-dental students as well. Dr. Violet, Dr. Giselle, Dr. Franklin, Dr. Peyton Aronson. Just what a joy to see your names popping up. These are the future of our profession, and you all warm my heart that you're joining us tonight to talk about my favorite subject is using just a very simple technology to add one of the most complicated things is how do we communicate with another human being, and how do we communicate effectively with our team as well as ourselves. So Brett, thanks for having me back, bud.
You bet. So the power of communicating, let's start there, Dr. Hyman. So the power of communicating as a dentist to patients versus just, we know you have to have hand skills to do quality dentistry, but talk a little bit about that power and the importance of the ability to communicate with them in addition to the importance of the hand skills.
Sure, Brett, it's a given in dentistry. You have to have the manual dexterity. It's a given that you have to deliver clinical excellence. The reality, it's been guesstimated that about 97% of your patients have no clue what you're doing for them technically. It's all the experience, and we are visual learners. So to look at a patient and say, you need a crown because I said so, I can see that your tooth cracked. If the patient doesn't own the problem, then you're in a battle. You're in a verbal jousting match with the patient, and that's no fun. It's hard enough to do the technical dentistry. I tell people dentistry is a hoot. It's a lot of fun. You're working with an area this big with a tongue in the way. But if you can't see it, the patient doesn't own the problem. You haven't documented it. So my students at the UNC Adams School of Dentistry know it, and my audiences as well. The rule, if you're a student of Dr. Marks, is you take a picture on every patient for every procedure before, during, and after. And that's called supper time. That's called mic drop. That's called what a glorious way to be a dentist. To be able to put a picture in front of a patient, see where you were, show them the during to confirm that you made the right diagnosis and treatment plan, and then the after when you've solved their problem. So it's just so critical, Brett. And again, so much of our education in dentistry is we've got all this knowledge and we look at the patient and say, you'll do it because I said so. In 2024, that just doesn't work anymore. So we can agonize over that, or we can say, well, what are the top dentists, the highest producing dentists, the most successful men and women in dentistry? What do they do? The bottom line, friends, they take a picture on every patient for every procedure before, during, and after. It's as simple as that. So you have to work with the right company and you have to have the right training for your team as well as yourself. And
So
you have to back that up.
this is part of that doctor presentation to the patient. So for yourself, you're now on the operative side. And so you're doing restorative dentistry. So when you're taking that before picture, that makes sense. But in the during photo, so do you stop in the middle of the prep when you're completed with the prep and you take the picture? Do you have communication with the patient at that point? Or do you just simply take the
Absolutely.
picture and then finish the conversation once you've taken the after?
There's a handful of patients, Brett, that'll say, I don't want to see it. And then you say, well, this isn't for you. This is for me. This is me seeing the image, the HD image, 40 times the size in color. So I can make sure I've got all the infection out of your body. I can make sure all the cracked areas have been removed. So always speaking in a benefit statement. So imagine you've scheduled an occlusal amalgam. You take that out and you see that the mesial and distal marginal ridges are fractured. Without the photo to say to the patient, well, this was a one surface filling and now it's three. Your investment just went up another $100. Then you have the patient looking at you saying, every time I come in here, you upsell me. Every time I come in here, it's something different. How come you didn't make the right diagnosis before? So that's a threat and that's a confrontation, and nobody likes that. So the joy of this is just to say, you know what, that's a good question. I did the very finest dentistry I could do. This was my initial impression. Once I've taken out your mercury filling, I found, in fact, the cavity's right into the nerve. The cavity's blown out the side of your tooth. It's blown out the cheek side, the tongue side, towards the middle of your mouth, the most distant part. So it's just a wonderful way to communicate. And you can also look at the patient and say, during the procedure, Mr. Wilson, if I see changes going on in your mouth, do I have your permission to tell you? And almost always a patient's going to say yes. And you can also pause, sit them up and show them and say, thank you for trusting me. Thanks for coming in today. You've got 3 mercury fillings in a row. You asked me to do one today. It looks like they were all filled at the same time, probably when Nixon was in office back in 1973. Now I've taken out the mercury filling in this first one. Can you see how much decay is underneath it? How much cavity? How many cracks are in the tooth? Mr. Wilson, while I have you numb, does it make sense to go ahead and do these other 2 fillings? Does it make sense when I see how badly this first one is? Would you like to know what's underneath these other 2 fillings? So that's an opportunity. If the patient hasn't bought into comprehensive care yet, you can give them a chance to own their problems. If our friends in the insurance industry try to come back and say, you did unnecessary work, you can panic, or you can say, you know what, that's a good question. Let's go to the video. Let's look at our HD images and confirm we've done the right thing. Brett, we talk for ages about training of the team and engaging the team. They really have to own what's going on. So doctors have said to me, so in my practice in Greensboro, North Carolina, I had 8 operatories with 8 digidocs. We took a picture on every patient for every procedure. I would not go in and check a hygienist if there wasn't a current photo up. It takes 5 seconds to get that before photo. And it's not a confrontation. It's not a battle. I would just say to my hygienist, I adore you. I appreciate you. As soon as you take a picture, I'll come in and check you. So it's just as simple as that. You can also take pictures of successful dentistry that you've done and say, Dr. Mark did this 6 months ago. Let's check it out. Wow, look at this quadrant. It looks beautiful. Wasn't that a good decision? Remember, we talked about this other quadrant. Now, you said you wanted to defer that. Would you like this quadrant full of MODFL, TWA, KLM amalgams to look like the quad that we just restored 6 months ago? So it's constantly reinforcing you made the right decisions. It's reinforcing future dentistry. It's giving the patients an opportunity to ask for optimal health and optimal care.
You mentioned the taking the word need out of your vocabulary. Talk to us about that.
Sure, Brett, man, nobody needs to have another human being look at them and say, You need a crown. You need a filling. You need to floss. You need to lose weight. You need to change that hairstyle. Need is a punitive four-letter word. The better four-letter word I hope the men and women dentistry adopt is, what do you want? It's your body. Brett, you're a handsome young man. You got a gorgeous wife, three magnificent children. How healthy you want to get, how soon you want to get there. Brett, in your own words, guide me. What do you want me to do for you? Do you want to avoid a root canal? Do you want to avoid complex care? Do you want to avoid, I know you're with your family every weekend. How would you feel when you're coaching your son in football if you have a tooth split during a game? Would that be inconvenient for you? So I like the thought of speaking in benefit statements and future focusing in a positive way, not, well, Brett, you don't want a root canal, do you? But Brett, what would health look like to you? Guide me in your own words. What do you want me to do for you? Do you want to save time? Do you want to save money? Do you want fresher breath? What are your goals for your health, teeth, and smile? God, guide me, bud. So it's a more positive conversation. And again, nobody wants to be told you need to do this because I said so. We have all of this training. The men and women in dentistry, I look at my future UNC Tar Heel students, they're so smart and so talented. But the fact is, everything that made you successful in your dental in your pre-dental education, I ask you a question, you give me the answer, you get the A. In the real world, I think it's answering questions with more questions so the patient asks for the optimal care. And that's how a mediocre guy like me ended with a top 1% practice.
That's fantastic. So let's move from the doctor's side to hygiene. So now you're coming over to check a patient. You mentioned that if images aren't on the screen, and this does work like a charm, you don't have to be ugly about it. Hey, as soon as images are on the screen, I'll be back in to check the patient. No problem. You just turn around and walk away. Don't check the patient. Now the images are on the screen. Let's talk about you coming into the hygiene room. We're going to empower the hygienist. We're going to talk through some of the verbiage that you use with patients. So give us an example of like how do you empower a hygienist properly? Because I know for my experience, my wife's a hygienist, has been for a long time. And we know that hygienists aren't to diagnose, but they can also be a very good asset to you, right? And really set you up if you know and trust them. But what we hear a lot in the industry is that they get defeated. They key it up for the dentist, and the dentist comes in and just disagrees with everything that they say, and now all of a sudden they're deflated and they're not encouraged or motivated to do that again. So could you talk through that just a bit?
I'd be pleased to, Brett. Nothing irks me worse in dentistry than our blessed hygienist teeing it up. You've had a morning huddle, morning meeting where you've looked and you see Mr. Wilson's coming in at 8 o'clock and he has a watch on 30 and 31. And the hygienist takes a beautiful HD Digidoc photo of your big cracked MODFL TWA KLM amalgam that's been in there for 35 years. And Dr. Wonderful walks in and says, let's watch it. Let me think about it. It could probably last a little longer. And then the hygienist will not take other photos. You've defeated them. You've said you want to do optimal care dentistry. You want the patients to achieve their goals, and then you cut their legs out from underneath them. So that's the worst thing. So I've tried to counsel my audiences, doctors, that you got to trust your team. And if they're going to put a picture up there of changes going on, the only thing I want to hear a doctor say is you want that fixed in gold or white. You want this done in morning or afternoon. And in my office, because of our systems, the next statement was, Brett, we just had a change in our schedule, which means to the assistants, you're not getting lunch. We're going to fix it right then. If the patient buys in, we get comfortable financials and we dance. So on average, Brett, my team added at least $2,000 a day every day I worked. Most dentists work 200 days a year. That's $400,000 a year just in stuff lying around because I had a digidoc in every operatorium. I took a picture of every patient. We constantly were documenting what we were doing. So back to the point, the handoff has to be proper. You meet in your morning huddle, morning meeting with your hygienist. You see who has undone dentistry. The hygienist commit to get those current photos, perhaps show some former dentistry that you did that looks good, show the needed dentistry. And doctor, all you come in and the hygienist guides you through the exam. We review what they've seen with the oral cancer exam, the periodontal health, TMJ, airway, whitening, wherever the patient is in their goals for their optimal care plan. And then when you look at the pictures, Brett, people have honored me. They've said, Dr. Mark, I never met anyone that got the level of case acceptance that you did. The verbal skill that I tried to use to get to yes, basically 99.99% of the time, is we take a big Digidoc image and I'd look at the patient and just make the nastiest face you can and just say, wow. Because in a business negotiation, the first one to speak
Loses.
loses. The patient says, what's that line? I'll say, well, what do you think it is? And they'll say, is that cancer? No. Is that a crack? How can I help you? Are you telling me my tooth is cracked? Yes. How can I help you? You want it fixed in gold or white? You want mornings or afternoons? And it's off to the races. So that's a really fun way to work. So the doctors, Brett, I find the resistance from the doctors often is a reflection of their self-esteem and their self-worth, and perhaps them not believing in themselves as a clinician. So I got over that pretty quickly. I had my mouth restored, my old mercury fillings taken out and secured with ceramics. And I believe in it completely. And I believe in taking great care of my patients. So that just made a huge difference and a huge impact on my patients.
Love that. You had made a comment before, just in one of our conversations. Maybe I heard this in one of your lectures, just talking about how you worked for the hygienist. Use some of that language with us.
Sure. Well, but my number one receptionist, Ms. Mary Catherine Ward, was only with me almost 25 years. My lead dental assistant, Athena Escobedo Calloway, was with me almost 20 years. Three of my hygienists were 15 years, another one 14 years. And I would say to anybody, I work for them. They're my team. I'm the captain, but they're my priceless gems. And I took great care of the team. I spoiled them. And I've had people say, well, you just got lucky. You got this great team. Every one of these magnificent teammates that I worked with, Brett, worked for another dentist, left them, came to me, and stayed. And people say, well, you just paid them a lot of money. I did because they earned it. They deserved it. We did gobs of continuing education together. We were all trained. Everyone in the office knew how to take intraoral camera photos. They knew what Dr. Mark expected. They knew how we got comfortable financials from Care Credit. They knew we used the Isolite, the 5-in-1 bite block, tongue retractor, cheek retractor, suction LED light. We had 8 operatories with 8 Isolites. We had 8 operatories with 8 Digidocs. We had buffering of the local in every operatory. It's 3 magic words, Brett. Success leaves clues. So what do the highly successful men and women in dentistry do? They invest in the right equipment. They train the team on it. The philosophy of the practice is clear, and then you get out of their way and let them dance.
What does that handoff look like? Like when you're walking into a hygiene room and that hygienist, and we hear this as well, is that the hygienist will say, well, I planned on having a proper handoff, but the doctor just kind of cut me off and just started in on the conversation with the patient, which is natural. That can happen, but speak to just the power of a proper handoff and those patients hearing the verbiage of what's going on more than once.
Sure, I think again that's part of training and role playing with your team during lunch and learns. We also had sticky notes chairside where the team would write me notes about what they had discussed so I could make sure that we had walked through that conversation. One of the worst things in the world for me is a patient calls the office and say, I broke a tooth. How can we help you? I broke a tooth, the lower right side. They walk into the office, another business team member greets them. Why are you here? I broke a tooth. Assistant takes them back. Why are you here? I broke a tooth. Dr. Wonderful walks in. Why are you here today? And it's like, isn't anyone listening to me?
Right.
So I would love it when I'd look at my superstar hygienist like Elena, who you met and is a superstar, and I'd say, what a joy to see, Brett. And of course, knowing you and knowing your wife and your kids and your mom and your pop, I would do some pleasantries and then say, Laney, guide me. Tell me what y'all talk about today. You just spent 55 minutes with Mr. Wilson. I won't go through the same questions. You took a blood pressure. You went over the medical dental history. You talked about goals for your health, teeth, and smile. You celebrated the completed dentistry. You planted seeds for the undone dentistry. Then for me to come in and go back over all that, it's a waste of everybody's time. So we did have a system to do that. The hygienist would talk about the periodontal health. They would talk about the successes that we had. And here's what's next in the journey towards optimal health. I didn't believe, Brett, that patients said no to me. They said not yet. Because again, people do buy what they value, they buy what they want, not necessarily what they need, and they do buy it at their own pace. And so I trusted that. Again, I love to say to my students at UNC, there's no hostages. Patient doesn't have to come to your practice. We don't go to Walmart and tackle people and drag them into our office. They walked into a dental office, probably showing they're interested in purchasing some level of health. So we may as well use the #1 communication tool, which is a gorgeous HD image, to celebrate where there's healthy enamel and good clean areas, and where there's schmutzy. Do you all know schmutz? Where there's tartar on the teeth, where they're not flossing well, where there's failing dentistry. And I always try to compliment. Here's beautiful, healthy white enamel, Brett. Way to go. You got 28 teeth, Bubba. 27 of them look great. However, I see some dramatic changes here, sir. How can I help you?
And wouldn't you also compliment their ability to capture photos? Talk a
The
little bit like,
team,
what would you say? Like, what would you say to a hygienist when you'd walk into a room and there was a really nice image on the screen? Like, how would you promote them, and how would you build them up and edify them?
love it. Brett, I'd come in and say, Laney, I am so proud of these beautiful photos that you've taken. When there's a fuzzy photo, you know the old fat man took them. When I see a crisp, clear, centered photo, I know you took it. You just warmed my heart. What a joy it is to work for you.
There it
And the
is.
patients usually chuckle at that too. You want to ruin a practice, friends? Humiliate, correct, reprimand a patient, a, a, a teammate in front of a patient or in front of another teammate. That poisons the well. Any constructive discussion, I always did that in private. So that's important. Again, my team was fantastic. Brett, we went almost 15 years with essentially no turnover. So everyone knew the verbal skills. They could tell my jokes better than I could. They knew the patients well. There was a high level of trust. There was just an extraordinary level of case acceptance because we were working with friends. We were working with folks that we knew and we had relationships with. And if
Let's
someone wasn't ready to fix something, I wouldn't say it's not no, it's not yet. And I'd always try to encourage my students at UNC and my audiences to ask one more question. Can I think about it? The temptation is to say, well, what do you want to think about? But I'd rather you say, Brett, it's your body, it's your health. But if you were ever going to fix this, what would be the reason? Is it to save time, to save money? You don't want a root canal. You don't want the tooth to break when you're coaching your son in football. Guide me, bud. If you were ever going to fix this, what would be the #1 reason?
hmm.
So part of that is the verbal skills and the listening and complimenting the patients. It is their body. It is their health. And I get it.
One of your favorite books, Seven Habits of Highly Effective People. Talk a bit about listening, and then I want to move into just sharing a few photos and just going through what you would say to a patient, the questions that you would ask as you look at and view images, just like you would in your dental practice. But before we get
Love
there, if
to.
you don't mind, just touch on the listening there.
I'd be excited. 1989, I took a 2-day Stephen Covey 7 Habits of Highly Effective People training course and changed my life. I got to meet Dr. Covey before he died. I got my stalker picture with him, but all the 7 habits are gold. But habit 5, Brett, changed my life. Seek first to understand, then to be understood. And so much of that is meeting the patient where they are, listening reflectively and compassionately, and feeding back to them, complimenting what looks good, planting seeds for future care, listening to what their goals are for their health, teeth, and smile. So many of us just listen, preparing to respond and respond autobiographically. Brad, why are you here? I broke a tooth. Well, man, I broke a tooth. Let me tell you about it. I got a root canal and it hurt, and I swallowed the temporary. It was terrible. I mean, who asked you? Brett, where are you in your life? So that's just, and part of the other teaching point tonight, as an office, we read success literature together. The entire team read Seven Habits of Highly Effective People. We all studied Dale Carnegie, How to Win Friends and Influence People. We all read ZAP, ZAPP, The Lightning of Empowerment by Bynum and Cox, Who Moved My Cheese, Raving Fans, Millionaire Next Door, Creating a Healthy Work Environment, Dr. Kathy Jameson, Start with Why, Simon Sinek, Good to Great by Collins. About every 4, 5, 6, 7 months, I'd buy another motivational, positive book, give it out to the team, and say, next month's team meeting, we're going to discuss this. So that was me investing in my team, in their education, and investing them personally and professionally. It's a wonderful way to grow.
Love it. It's fantastic. Let's take a look at just a couple of photos here. So one would be a smile image that would be on the screen as you walk into the room. You've given the patient an opportunity to take a look at their smile, something they don't always do. Don't notice things that they would typically notice if they were smiling at home, right? And the hygienist doesn't really have to say much. How do you approach an image like this as you walk into the room?
So I would walk in, I would ask the hygienist what they've discussed. And particularly when I see a smile like this, what I teach my students is always start peripheral, look at the lips, look at the tissue. For me, it looks like the lower anteriors, looks like the patient had not had their teeth cleaned in a while. Looks like a lot of plaque and tartar there. When I look at the upper left side, tooth number 9, 10, and 11, that's really flat, a lot of wear. I would want to know, is this person an athlete? Was that from trauma? Was it from grinding their teeth? But I love the compliment. So specifically, I would say if this was your mouth, Brett, when I look between the two centrals, number 8 and number 9, look what a great job you're cleaning there. The papillae, the little gum triangle, it's pink and tight and beautiful. However, let's look below at the bottom two front teeth, number 24, 25. Okay, if you compare where the gum papillae is of the top two teeth to the bottom two teeth, you see the amount of plaque and tartar that's built up. Brett, has anyone ever talked to you about cleaning that area better? Do you have a Sonicare at home? Yeah, but the brush wore out or the battery died, so I quit using it. Brett, are you interested in having fresher breath? Are you interested in preventing the link of gum disease to heart disease, diabetes, low birth weight babies, premature babies, Alzheimer's, all of the inflammatory processes? We now link gum disease to all these medical issues. Brett, if you were ever going to clean better, what would be your interest? So I try to put it right back to them. Not, dude, you're not brushing very well. Shame on you. You need to fix it. Brett, is that your mouth?
It is not. No, it was actually a
Okay.
rep that I was with when we were in a dental practice. Just took a quick shot of his smile, one
It's
day.
a
So,
good looking smile. I bet it was whiter in its day. So that's a chance to talk about whitening. But that is what catches my eye is the wear of those teeth. So I want to know, is it gritting, grinding, bruxism, or was it trauma from sports? And the plaque and calculus, the tartar on the bottom and lower anteriors. Let's do the next one.
okay,
That's sort of what you're looking for.
absolutely. And please, if anybody has a question, you have a patient objection, put it in the chat. We'll ask that objection as if you had just heard it today, perhaps, and we'll answer it for you.
So if this was a photo and I came in again, I would ask the hygienist to guide me. What did you all speak about? When I look at this photo, so that appears to be a terminal molar. Perhaps that's tooth number 15, upper left 12-year molar. And if this was your tooth, Brett, I'd say, Brett, have you ever seen your teeth on a monitor before? And you may say, every dentist I've been to the past 10 years kept telling me I need this fixed. Or you may go, I've never seen this. So I do love the give and the take. Brett, can you see how much healthy white enamel is on this tooth? For your advanced age, young man, well done. You've got some gorgeous, healthy enamel here. However, do you see the mercury filling in the back? And I would show the line about halfway, right where the occlusal bends down towards the palatal. Can you see the crack line there, Brett? A little, go further to your right there, dude. A little bit left, right there. You had it. Left, 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 left. Keep going, keep going. Stop right there. I'd say, Brett, do you see that line? Let's role play, Brett. Sir, do you see that line?
I do. Yes.
Do you know what that is?
I do not know.
What would you think, bud?
Looks like it's a crack.
Yes, sir. How can I help you?
Cracks don't sound like those are that doesn't sound like a good thing, but it doesn't. I don't really feel
Respect
it.
that.
It doesn't hurt. I've not had any issues with it. Gosh, it's been there a long time.
Brett, can I ask you a question?
Sure.
Were you waiting for pain to take action? Was it your understanding that dental pain was the reason to go ahead and fix something? Or I may say, Brett, have you ever had a cracked filling before? Yeah, and I got one on the other side and he fixed it and my tooth hurt for 6 months. Brett, I bet that was a frustration. My experience after doing this since 1492 is if we fix these cracked areas proactively before they hurt, often the patient's not going to be in dramatic pain after. If we wait, because when there's a crack, as you described it, and saliva is seeping in there every day, the chance of something worse growing underneath that is high. How would that make you feel?
Not good.
And I would ask my audiences, Brett, to be comfortable with silence. Well, Brett, how would that make you feel? Well, if we could fix it, we could fill it, we could pull it. Be cool, chill out, let the patient marinate on it. When I look at the composite resin in the mesial half of the tooth, it looks like that's cracked into two pieces as well. Kind of the little circular area, and then the MO right there, that little, it looks like a separation between those two. And I'd say, Brett, what's the history? When was that done? If you say 10 years ago, I'd say, wow, somebody did a beautiful job. You got 10 years out of that filling. Well done, sir. However, I see some dramatic changes. Would you like to know what's new in modern dentistry? If you said it was done 2 weeks ago, I'd say, wow, someone worked really hard to make that filling look that ugly. No, I wouldn't say that. I'd say it. Somebody did their best. It looks like there's a crack area there. It looks like you've lost a piece of the white filling going towards your cheek. Sir, how can I help you? Well,
Love
what
that.
do I need? Well, what do you want? Do you want to save time? Do you want to save money? Do you want to avoid a root canal? Guide me, Brett. Why'd you come in today, man? So I want to meet you where you are, and I want to ask how healthy you want to get and how soon you want to get there.
Guide me. Why'd you come in today? That's so good. You've never what I love about you is you've never seen these images. Like we've not practiced this. It's just
No, this is
impromptu role play.
this is first take unrehearsed.
Right.
This is not a teenager. Whoever did you take this shot, Brett?
I did. I took that shot. That's my mouth, actually.
It is not.
It is, believe it or not. I
Is
just
it
had
really?
it fixed on Friday this last week. I had
That's
three
called
omelets done.
supper time, man. I would say, Brett, it looks like you've been working really hard running your company, leading your beautiful family, coaching your kids in sports. May I humbly suggest, young man, that it's Brett time? There's looks like there's some areas in your mouth that you're cleaning beautifully and some areas that just got away from you. Brett, when we look at the molar on the left, I would point out the white, healthy enamel. So you got some gorgeous, healthy white enamel there. Yeah, look at that. Well done. However, go towards the gum line. Brett, do you see those color changes?
Yes.
In my dental world, that's a dramatic amount of cavity for such a health conscious young man like yourself. I bet you've been working really hard, bud. Not shame on you. You need to brush better. That doesn't motivate the president of a company. You busy man. I get it. Brett, when I
Audience,
look at the tooth above,
we're just gonna jump in here real quick. Audience, I hope you picked up on that. Is that he's speaking to the patient and what motivates the patient. Like Dr. Hyman knows me. He knows I like health, I like fitness, and so he just spoke to that because he knows me. That's subtle, but that's so powerful.
So part of the compliment, particularly to the president of a company like Brett, he doesn't need a lecture. He doesn't need me to fuss at him. He's been traveling all over the world and running his company and dealing with his family, and he doesn't need a lecture. It's just, Brett, is it time to get healthy, bud?
Okay.
If you can carve out a morning for me, we're going to get these solved. I would take out the decayed area and take a during photo to show Brett he made the right decision to get healthy. We talked about the tooth on the left side of the image. On the other side, where the composite is with the leaking around it, Brett, can you put the arrow over there? Brett, do you have any idea how old that filling is?
15 years.
You got a sensational result. The last thing you need to do, friends, is criticize his last dentist. Oh, I could have done better than that. You don't know the story. Who was your last dentist? Was my dad's best friend. And now you've said you went to a crappy dentist. Don't do that to somebody. Ask open-endedly. What's the history? How long's that been in there? 15 years? Brett, well done, young man. You kept that area clean a long time. Looks like it's just past its expiration date. You see the black above and below. You got 2 areas of cavity. Young doctors, young teammates on the call tonight, be cautious about using dental terminology. I said to a patient once, "Well, you have active caries." The patient said, "Well, as long as it's not a cavity, I'm not doing anything." Like, you have a cavity. Well, why didn't you tell me? I just did. No, you didn't. So, Brett, on that tooth, you got so much white, healthy enamel. Well done. However, I see active areas of cavity. It looks like you chipped a part of the filling towards the biting edge. It looks at the gum line like there's some changing going on. I know you've been working hard, bud. Is it Brett time? Is it time for you to get healthy?
Very good. That's
Tim?
fantastic. Let's take it from hygiene. They've handed off. You've had this conversation. You've presented this to the patient. Now it's time to walk towards treatment coordinator. Talk to us in your experience of how everything is teed up, everything's beautiful, everyone has said everything you've said, patient's ready to go. We're now walking towards the front, towards the treatment coordinator.
One of the most powerful statements my coach, hero, and dear friend, Dr. Kathy Jameson, said to me 24 years ago. She looked at me and said, "Mark, how do you create the sense of urgency?" Please write those 8 words down, friends. How do you create the sense of urgency? Part of having a network dental office is your hygienists have taken a gorgeous photo for Brett of those 2 molars. He sees the urgency to act. Then I want to not just tell him, go up front and check out. Somebody's going to physically walk and do the handoff. If you're going to sit down with a treatment coordinator in a consultation room or one of the business team members up front and say, "Mr. Wilson's finished today. 28 teeth, 26 look fantastic." However, he recognizes he's got some significant changes in 2 spots in his mouth and he wants to get those taken care of in the next week. Can you find him a time he prefers morning? Mr. Wilson said he does not want root canals. He wants our first available appointment to get healthy. Will you please help me take care of him? Let's put him on our priority list.
It's excellent.
My hours traditionally, Brett, were 8 to 5. Once a week, I came in at 7 a.m. For someone just like yourself, the president of a company comes in and they're busy, man. I'm a morning person. I'm up. I'm ready to dance. I can do a whole lot of dentistry from 7 to 8 a.m. so that a businessman can get a whole lot of their care, man or woman, can get a lot of their care done and get on about their day. For me to look at you, to have created that sense of urgency and then say, "Well, I'll see you in this is May. I'll see you in August to fill those." No, I've got the urgency. I want you in within the next week. So part of that is block. That's for another day, but you block your schedule where you reserve preferred times for boulders for big major treatment. Brett, did you get fillings or crowns on those teeth?
I had Cerakote lace.
Beautiful. So I'm guessing roughly about a $3,000 investment retail.
Oh yeah, easily.
Do I want to look at Mr. Wilson and say, there's $3,000 of undone dentistry here and I'll see you in 3 months? I'm going to say, this is Tuesday. In the next 3 days, the next 5 days, when would you like to get this taken care of before it ends up with a slow, painful root canal? I've created the sense of urgency. I don't want to let it get away.
One of the things, Dr. Hyman, I feel like in dentistry is that dentists they can tend to get bogged down by the drill and fill type of dentistry, and they're kind of held back with some of the dentistry that they really are passionate about. They want to do more like transformative dentistry to patients, and more dentistry are the things that they love to do. And so hopefully everyone's taking some of this content and thinking about like, what else do I want to do in my practice? That's what I would love to learn from you all that are attending is what are those things? And us help you develop a roadmap to get you there. I just believe in talking to dentists, ask questions a lot of what do you want to do that you're not doing currently? And everyone has something that they want to do, that they're more implants, more restorative, more cosmetic dentistry, more ortho, you name it. There's something that they're passionate about, but using this, not just on the crowns, which is important, but using it to language that will build where they want to go in their practice. But that treatment coordinator, we're going to hold a whole webinar on just treatment coordinators and talking about monthly payments and what that looks like for them and really coaching them up. So we'll let you all know when that happens. Does anyone have questions for Dr. Hyman? We've got a few minutes left before we bring Brian Sawalya on. I'd love to answer any questions that you all have. It may be an objection that your hygienist has, maybe a way to overcome something that they've brought up, or another objection that a patient may have. Love to field any of those that you may have. Just put it in that Q&A. Just type that in, and I'll make sure that we talk through it.
For people that logged on late, I put my speaking website on there. You can email me directly through there. You're part of my family now. You're part of the DigiDoc family. And it's just, I started working with this company 24 years ago. Brett, you had baby teeth. And it changed my life. I bought 4 versions of their cameras, and it absolutely was transformative for my practice. And it's not about the money, but you are running a business. It is about having the #1 rated camera by Reality Magazine, having the #1 communication tool, so you don't have to work so hard. So the patients own their problems. They're included in the learning for what level of health they have, and then you can guide them for where they want to go. It just makes the dentistry so much more fun. Brett speaks about what type of dentistry, what's your passion? I loved working on people that wanted to keep their teeth the rest of their life. I didn't like arguing with folks that didn't value it. So I love the thought of working with the willing. It's the same with my teammates. There were no hostages. No one had to come work with me. They didn't like what we were serving at our restaurant, at our practice. They could go work somewhere else. The patients weren't happy with Dr. Mark. I had plenty of those. More were happy with me than weren't. But let them go take it somewhere else. There were 200 some dentists in Greensboro. And when they picked me, I was very flattered by that. But the huge part of my success, our verbal skills were superior, and our technology, having an HD image in front of the patient, it just made it a lot of fun.
Dr. Hyman's he's real, and he's very sincere in that. If you have a question, email him. He will answer it. So we have a question: is how do you refer out to a specialist?
Beautiful. Question is, how do we refer out to a specialist? So imagine that you've taken your DigiDoc photo of somebody and there's a class 2 D2 laterals, a diastomata between 8 and 9, and severe crowding of lower anteriors. It's an ortho case and you're not doing clear aligner therapy in your practice. Then I would mail that photo to my specialist and say, here's my concerns. Would love for you to see this new patient. Anytime I did, because I did a 2-year oral medicine hospital dental residency, I did a lot of biopsies in my practice. And I would take a before photo. I would take a periodontal probe next to the lesion and take a photo with the DigiDoc. And then I'd do the biopsy and send the photo and the specimen to the oral pathologist to say, here's the patient, here's the medical dental history, here's what I think this is, let me know. somebody's got cracked teeth and irreversible pulpitis, I'd send a picture to my endodontist. Here's what I see. Here's my diagnosis. I feel like it's irreversible pulpitis. What do you think? So whether it was my orthodontist, endodontist, periodontist, somebody that needs gum grafting, somebody that needs aesthetic crown lengthening, I would use those for the photos. It's just a wonderful way to communicate.
Perfect. Another question. How did you overcome a language barrier and provide the same high quality level of care and connection with your patients?
Question about language barrier. Part of that, as I shared before, was not speaking dentalese, is to meet the patients where they are and ask them, what's your understanding of this? The worst thing I think we ask patients is, do you have any questions? It's intimidating. You just went through an hour and a half explanation about a dental problem. Do you have any questions? Their head is spinning. They don't know what you're talking about, which is why I love using an HD image to say, here's the healthy enamel. Here's the changes that I see going on. Here's your choices, A, B, C. Tell me, how can I help you? So language barriers can be from an intellectual point of view, can be because English isn't a primary language for somebody. In our office, I speak some very broken Spanish and a little bit of Hebrew. We had 3 women in my office that were of Hispanic heritage that were fluent in Spanish. And for them to present treatment in Spanish to Spanish native speakers was such a benefit. So that can be a gift for those of you joining the dental family, for those of you early in your career. If you have a chance to hire bilingual teammates, you can advertise that on your website. You can advertise that on your social media. It just can be an unbelievable thing. So language barriers, again, I think it's important not to talk down to people and to ask them in your own words, when you've presented a treatment plan, Brett, in your own words, would you tell me what's your understanding of the situation? I don't know. Sounds like a lot of money to me. Didn't you hear what I just talked about? Didn't I explain to you that there is a vertical fracture through the dento-enamel junction? I don't know what that is. So part of that's going to be role playing. Part of it is basic human relation skills and not being in a rush.
Good. Well, I encourage anyone else to ask questions. I'm going to bring on Brian Sawyer.
Last 8, 9 months, I've been doing a lot of research just surrounding the dental coding, and happened to run across a website that I'd kind of like to share with everybody. It's a little bit of a golden nugget, something that everyone can start using immediately and generate some new revenue right off the bat. So Brett, I don't know if you have ability to go ahead and share your screen. I'd like you to just to walk you through a website. And then once we get there, Dr. Hyman, we're going to kind of use you as an example. So guys, the website we're going to go to is fairhealthconsumer.org. So it's going to be fairhealthconsumer.org. Like Brett said, I've traveled all over the country. I've been at hundreds and hundreds of offices, and every time I walk in and share this information, doctors usually have to stop me in mid-sentence and go grab their front office manager and have me start over again. So if you're not familiar with this website, you kind of view this as the Better Business Bureau of Medical and Dental. Dr. Hyman, have you ever seen this website before?
Brian, I have not that I recall.
Okay, so Brett, as we go through this, I'd like you to click on dental services there for me. This is going to prompt you to enter your zip codes. So anywhere you are in the country, you're going to enter your office's zip code. Dr. Hyman, if you don't mind sharing where your office was located, the zip code there.
Sure, 27408.
All right, Brett, you're just going to hit the next button. Perfect. All right, guys, here is a huge, huge one that I need you to write down and remember. The code that we're looking at today is D as in dog 0350. D0350. Brett, if you want to search that, you're going to get a prompt to agree. This just so you're not going to sue this website for the information they're going to provide for you. So if you don't mind agreeing. All right, Brett, can you read that code for us?
Photographic images of the jaw and teeth taken by intraoral and extraoral cameras.
Okay, before we go to the next step, I'd just like all the doctors on here, just think of your hygienist for a minute. Dr. Hyman, how many hygienists did you have working for you?
Between 2 and 4.
2 and 4. And on average, how many patients a day did they see?
So my hygienist had an hour and 10 minutes per patient. So they would see 7 adults. When I bought the practice, Brian, my hygienists were seeing 10 adults for 45 minutes a day. And it's almost counterintuitive. I made them slow down, use the DigiDoc when everybody do full mouth probing, proper necessary radiographs, and their production skyrocketed. They saw less people but did more work.
Awesome. Okay, so just we're gonna go on a super ultra conservative here, Dr. Hyman. We're just gonna say you had 2 hygienists and they were seeing on average 8 patients a day. Okay, so that's
Sure.
16 patients that they were seeing a day. On average, dental office is open what 20 days a month.
Sure.
Okay, so 16, we're gonna times that by the 20. That's about 320 patients that your hygienists are seeing in any given month. Okay, here's where the fun part comes in. Brett, if you go ahead and click that, it should turn green. We're gonna get our cost here. Okay, so Dr. Hyman, you've not seen this before. In your specific zip code, currently on code D0350, the average reimbursement in network is $54. Okay, $54 every time you code that out. On average, you're going to see the reimbursement from that insurance company. So we kind of established that your hygienists are seeing about 320 patients, right? We're going to times that by 54 real quick. Okay, this again, this is the average. You're looking at what's a little over 17,000 a month on that code reimbursement for 2 hygienists. Okay, again, this is just the average, all right? And this is super low hanging fruit. So you talked about having a camera in each of your operators' hands, right? In every single operatory. So
Yes, sir.
important is it to how important is it to have a camera in your hygienist's hands? Guys, this is such low hanging fruit, and it's a way to generate some really solid income very quickly. You already have the equipment. If you don't have it, just need to give me a holler, or give your digital doc rep a holler. We'll get you set up. But guys, this is a way to create some new revenue very, very quickly for the practice. You can do this in any zip code. Every zip code is going to be a little bit different. This website pulls information from all the insurance companies and puts that together for you. So again, Brett, this is just really low hanging fruit. This is a way for you to get paid for the work that you're already doing. So as insurance companies start mandating intraoral images alongside your radiographs, with that mandate comes these reimbursements.
So one question, common objection. What insurance companies are going to pay for this? How many insurance companies typically pay?
Great question. And there's some states that are way ahead of others. Some states are paying a lot more than others. The way you kind of look at it is just let's use Delta Dental, for example. So you got five of your patients have Delta Dental in the practice. They may have 5 different versions of Delta Dental. So patient number 1 might get a reimbursement check for $54. Patient number 2 might get a reimbursement check of $64. Patient number 3 might get a reimbursement check for $20. Patient 4 and 5 may get 0. Okay, and you are going to get those denied claims. There are going to be several times where you're going to get denied claims, but you have to follow this process for at least 3 to 6 months for you to start seeing that frequency. And what does it cost you to code? An extra, what, minute? 2 minutes to input that information? So if you're not utilizing this code, are you going to capture any of that $54 at all? No. So point being, images on every recall patient, every time. Code, every recall patient, every time.
When insurance companies don't pay, like they don't pay often on fluoride, most dental practices go ahead and charge the patient for that service, right? For fluoride. Same thing here. So the conversation is, in order for insurance to ultimately approve the treatment that we have planned to do, this one line here, $35, $54, whatever you choose to charge in your practice. That example that I gave you at the practice in Arkansas, that's simply what they're doing, and the patients have no problem making a $35 or $45 investment in those images. So we have resources to help you. We can help coach you through the process. If you have questions, we will be happy to answer those. But this is so good, Brian. Thank you.